Uh, Hi, students. Welcome back again to this series on professional exams made easy, targeted at the first MBBS university exams. And this is the episode 5 of Anatomy, where we will be discussing about the most frequently asked question from the chapter of lower limb, right? So till now we have covered head and neck, neuro, and then we have covered thorax, we have covered upper limb. So let's try to learn about some of the important topics that are very frequently asked from the section of lower limb. Hi, Karthik. Welcome. So as we have done in the previous sessions, we will first begin with the most frequently asked topics. We'll try to identify what are the high yield topics in the section of lower limb. And then we'll try to solve a few case-based questions which were asked previously in the university exams, right? So first, let's start with the bones and the joints of lower limb, right? Now, in the bones and joints of the lower limb, the first question that we can expect is from the topic of ischial tuberosity. As we know, to describe it in simple words, ischial tuberosity is a part of the hip bone, and it's a part of the hip bone on all of us basically sit, right? Why ischial tuberosity is very frequently asked? Because ischial tuberosity gives attachment to the hamstring muscles, right? So all the true hamstrings take their origin from the ischial tuberosity. So this is one of the reasons why ischial tuberosity is often asked, right? How the ischial tuberosity is divided into a triangular area and a quadrilateral area, where exactly the muscles are attached, where exactly it is related to the pad of fat, right? So this is regarding the ischial tuberosity. The next important question they'll ask is about difference between the male and female hip bone. This could be a very important 5 marker. Ischial tuberosity, most likely to be a short answer question, could be MCQ, right? But difference between male and female hip bone, yes, an important 5 marker. More common than this, they will also ask about difference between male and female pelvis. When we discuss about the most frequently asked topics in the section of the pelvis, we will talk about this again, right? What are the differences between male and female pelvis, right? Bony pelvis we are talking about, not the sagittal section, right? Then one more important 3 marker in the topic of bones and joints, right, is the linea aspera, right? What is linea aspera? Linea aspera is a thick elevation which is found on the posterior surface of the femur. Hi, sir. So linea aspera is the most uh, thickened or a linear ridge found on the posterior aspect of the femur. Almost 9 structures are attached here, starting from medial intermuscular septum to the lateral intermuscular septum, posterior intermuscular septum, the muscles between these two septums, right? All of these take their attachment or origin from the linea aspera. So this could be a very important 3 marker question for the university exam, right? Then, now this is a reasoning type of question that can be asked from the bones of the lower limb. What is the medical legal importance of the ossification of lower end of the femur? Remember, the ossification for the lower end of the femur basically arises just before birth or at 9th month of intrauterine life. The appearance of the ossification center for the lower end of the femur actually indicates fetal maturity, that the fetus was capable of independent existence, right? So this is one of the most important topic which can be asked for a 3 marker question, right? What is the medical legal significance of ossification of lower end of the femur? Remember again, ossification center for lower end of the femur appears at birth or 9th month of intrauterine life. So the appearance of this ossification center for the lower end of the femur basically signifies that the fetus has that maturity for independent existence or survival, right? Then the attachment to the intercondylar area of the tibia. right? So this could be again one more important 3 marker, right? So if you just draw the outline of the tibia, the superior surface of the tibia, right? The intercondylar area gives attachment to 6 important structures, right? Now, what are these important structures? So we can remember it by the mnemonic Medical College Lucknow, Lucknow Medical College, right? So what are these structures? So first structure we have is the anterior end of medial meniscus, right? Then posterior to this, we have the anterior. So this is medial meniscus, right? So anterior end of the anterior cruciate ligament. Then the L stands for the anterior end of lateral meniscus, right? Then what does this L stands for? This is the posterior horn of the lateral meniscus. M stands for the posterior horn of medial meniscus, and C stands for the posterior cruciate ligament. This is also a Viva question for your practical exam, but this could be a very important 3 marker question for your university exam, right? So you can just draw a simple diagram like this and show. Or otherwise, we can even draw the outline of, let's say, the medial meniscus. Okay. So let's imagine this is the medial meniscus, right? And then here we have the lateral meniscus. So this could be the lateral meniscus, right? So these simple diagrams, line diagrams, can be drawn to complete the answer, even if it's a 3 marker question. If you can depict it using a simple line diagram, nothing like it. Okay, so this is one more important 3 marker question for your exam. Are we clear? Now, this is regarding the most frequently asked topics and the most expected topics for your exams from the topic of bones alone, right? We will further talk about the joints because there are a lot of long essays that can be asked from the topic of joints of the lower limb, right? So if you are prepared with these topics, your preparation from the chapter of bones for the lower limb is done, right? Then the next important chapter, let's say, is front of the thigh, right? Now, front of the thigh, you can expect at least one question in every question paper, right? Every question paper, we have seen a question from this chapter of front of the thigh. Now, what are the possible questions? Remember, the great saphenous vein. This is a very important 10 marker question or a long essay question from this chapter. Now, this topic can even be asked for a 5 marker or your short essay. So we need to know how to condense the answer when the great saphenous vein is asked, right? Now, if great saphenous vein is asked in your exam, how will you write the answer? Okay, so just to give you a template, start with one line of introduction about what exactly great saphenous vein is. Great saphenous vein is the longest vein of the body. It is also called as the long saphenous vein. This could be enough, right? That is one line of introduction. And when we talk about veins, remember the next heading we will give is formation. How exactly the vein is formed? The vein is formed by the union of medial marginal vein and the medial end of the dorsal venous arch, right? Then, once we have written the formation, all the veins need to terminate, right? Where exactly the great saphenous vein will terminate? The great saphenous vein will terminate directly into the femoral vein at the saphenofemoral junction, which is located 4 centimeter below and lateral to pubic tubercle. This is what the examiner will expect, right? Introduction, formation, termination. Now comes course and relations, right? Now in course and relations, what do we write? Remember, in course and relation, we basically begin with the foot. This is exactly opposite to artery or a nerve. Remember, arteries and nerves, they basically go to periphery, right? Whereas when we talk about veins, they begin from the periphery and then they go towards the proximal aspect of the body. So always start with the foot. Then what is its course in the leg? Then in the thigh. This is how we should describe the course and relations of the great saphenous vein. Then add lines about tributaries. Even in tributaries, we'll do the same. So we'll start with the foot, we'll then write about leg, and then we'll write about the thigh. What are the tributaries that drain into the great saphenous vein, and what is the area of drainage? This is what we will write in tributaries. Done. After this, we will write about clinical anatomy. Done. In clinical anatomy, of course, we'll be talking about the varicose veins. Right? Just see the headings which we have written. We have written a line of introduction. We have written about formation, termination, course and relation, where we have split, then tributaries and clinical anatomy. We have used 6 headings to describe the anatomy of varicose veins. Now, this is what the examiner will look at. Have you structured your answer under different subheadings, and in that, whether you have used further subheadings, right? This is how you should write if great saphenous vein is asked for a long essay, right? If it is asked for a short essay, one part that can be skipped would be the course and relation. We can still talk about formation, we can still talk about termination, tributaries and clinical anatomy, but if you want to skip, we can skip the course and relation part. But diagram is a must for both these questions. Done? Right. Hi, Tino. Hi. So this is regarding how we will attempt the question on great saphenous vein. Right. Then, so mark this. This is the most frequently asked vein in the entire body. Right. So you need to be prepared for great saphenous vein. Sometimes what happens is the question can be asked the venous drainage of the entire lower limb. Right. Even this could be a long essay for you. Then we need to classify the veins into superficial veins, deep veins, and perforators, and then describe each of them. Right? Then the next important question in the chapter of front of the thigh is the superficial inguinal nodes. Now, if this question is asked, how will you attempt it? Remember, superficial inguinal nodes are the lymph nodes which are responsible for draining the lower part of the anterior abdominal wall, the gluteal region, then the entire lower limb. So again, if the superficial inguinal node is asked, we will begin with a line of introduction, right? Then, where exactly these are located, right? Then, we will talk about the groups, right? We know that the superficial inguinal nodes, if we just draw the superficial inguinal nodes, so let's imagine this is the outline of the thigh and this is the inguinal ligament. So we have the superficial inguinal nodes which are arranged as the horizontal group and the vertical group, right? So this is what we mean by groups, right? Now, apart from groups, we need to talk about the afferents. From which part of the body the superficial inguinal nodes, let's say the horizontal group, medial or lateral, or the vertical group, will receive the lymph. Then, where does this lymph will go? Efferents. And of course, end it with clinical anatomy. Now, this not only applies for the inguinal nodes, this applies for your axillary nodes, even superior mesenteric nodes. Right. So any lymph node that we talk about, these are the 6 must write headings. You have to write lymph nodes under these headings with a proper line diagram. Right. As I said, this is for the superficial inguinal nodes specifically, but this template can be used for any other lymph node group in the body. Right. Done. Then There are two important modifications of deep fascia of the thigh. One is the iliotibial tract and the other one is the saphenous opening. The superficial inguinal nodes is often a 5-marker question. The iliotibial tract could be a 5-marker or even a 3-marker question. Define what is iliotibial tract. Describe how the iliotibial tract is formed. What is the function of the iliotibial tract? Okay, this is what we need to write if iliotibial tract is asked. Saphenous opening is a 3-marker question again. What is saphenous opening? Definition. Where is it present? Location. What are the structures piercing through the saphenous opening? Right? This is what we need to write if saphenous opening is asked. Saphenous opening, remember, is also one of the most frequently asked surface marking topics. Okay, in your practical exam. Right? Then, in the front of the thigh, if they ask about muscles, the quadriceps femoris can be asked as a 5-marker usually. We have not seen a long essay on quadriceps femoris. This could be a very important 5-marker question. How is quadriceps femoris formed? What are the components? Describe briefly. Since it's a 5-marker, describe briefly what is the origin of the vastus medialis, intermedius, lateralis, also the rectus femoris. Right? This is how we need to describe the quadriceps femoris. Right? Briefly discuss the attachments, talk about the nerve supply, and then the actions. Right? Done. Then femoral nerve could be again one more important 5-marker. As we have discussed any other peripheral nerve, if you have attended the previous session that we did about the upper limb topics, any peripheral nerve apart from the cranial nerve, we can describe under the formation under the headings of, again, introduction. Femoral nerve is the chief nerve of the thigh. One line of introduction, then formation. How the femoral nerve is formed? It is formed by the dorsal division of the ventral primary rami of L2, L3, L4. Termination. Femoral nerve terminates by dividing into anterior division and posterior division. Course and relations, right? The femoral nerve is formed in the posterior abdominal wall. It appears in the thigh. So we need to describe the course in the posterior abdominal wall, then in the thigh, right? Then we need to talk about branches and area of distribution. What are the branches coming from the trunk? What are the branches coming from the anterior division? What are the branches coming from the posterior division? Right? So this is how we will describe the entire femoral nerve. Are we clear? In the end, we will add a note on clinical anatomy. Right? Again, I will stress upon this. Right? When you are presenting your answer in your theory exam, remember, if you are deficient with the content, make sure you structure your answer well, right? Structuring your answer can compensate for content, right? But if you compromise on structuring the answer, right, then even with 100% content, you will still score less, right? That is why every session that we have done, we have focused on how to structure each answer. So please focus on this, right? Done. Then femoral triangle could be an important 10-marker. This is an important discussion topic for your gross anatomy practical, okay? If it is asked for theory, femoral triangle, what is it? A line of introduction. It's a triangular depression seen in the front of the thigh. Done. What about boundaries? How the base, apex, medial and lateral boundaries, roof and the floor are formed. Then contents. How they are arranged from medial to lateral. If it is a 10-marker, you need to describe the contents in brief. For example, the femoral vein, femoral artery, femoral nerve, how they are oriented. Then what covers these femoral vessels? The femoral sheath. What is femoral canal? All these need to be mentioned if it is asked for a 10-marker, right? In most of the universities, if this question comes, it is often as a 5 marker, right? If it comes as a 10 marker, this is how we will describe it. Then femoral sheath could be an important 5 marker or a 3 marker question. How do we attempt this? We will start with defining what is femoral sheath, then how the femoral sheath is formed, how it is divided into compartments, and then what are the contents and what is its clinical anatomy. Imagine this is a 5 marker question and you have written these 5 headings where the examiner will deduct the marks. If you have written it correctly, it is not just enough if you write the headings. You should have written the content also correctly, right? But if you structure like this, examiner will not be able to cut the marks in any way, right? Done. This is regarding femoral sheath. The medial compartment of the femoral sheath called as femoral canal. This is one more important 3 marker question, right? What is femoral canal? What are the boundaries of the femoral canal? What is the content? What is the clinical significance? In the topic of femoral canal, one reasoning question can be asked. Now, this reasoning question can be why the femoral hernia, right? Why femoral hernia is more common in females. This is a reasoning type of question you might get in the femoral canal. Now, what is the anatomical basis behind the occurrence of femoral hernia, which is more common in females? Remember, the wider pelvis and the narrow femoral vessels actually make the femoral canal in females more prone for femoral hernia, right? So this is one important 3 marker we need to be prepared for. Done? Are we clear? Right? Then, what about adductor canal? Adductor canal again could be an important 5 marker or even a 3 marker. Again, define what is adductor canal, where is it located, what are the boundaries, what are the contents, what is the clinical anatomy, right? This is how we need to structure the answer for adductor canal. Femoral artery and femoral nerve. Femoral nerve we have discussed already. Femoral artery again could be an important 5 marker question. And how we will attempt an artery? Femoral artery is the superficial artery of the lower limb, right? Remember, it is not the chief artery of the thigh. The chief artery of the front of the thigh is profunda femoris. It's not the femoral artery. So it is one of the superficial arteries of the front of the thigh. How is it formed or origin? It's a continuation of external iliac. How does it terminate? It terminates by continuing as popliteal artery, where at the 5th osteoaponeurotic opening of the adductor magnus. Course and relations, right? How it courses from the mid-inguinal point to the 5th osteoaponeurotic opening. What are the structures to which it is related? What are the branches? What are the areas supplied by it? And then the clinical anatomy. This is how we need to describe the anatomy of femoral artery. So in the entire topic of the lower limb, front of the thigh is one chapter, which is voluminous. And as I said, you can expect one question from this chapter definitely in every exam. Right? Done. This is regarding the front of the thigh. Then, what about medial side? Medial side, occasionally we get questions, but there are again limited topics. The gyropes, right? The gracilis muscle, then we have the adductor, and then we have the semitendinosus. So how exactly these muscles form the gyropes, how they originate, how they converge on the tibia, what is their action, right? Then the adductor magnus, these two could be important 5 marker question from this chapter. Obturator nerve, again one more important 5 marker question. And this is no different from the femoral nerve that we just discussed. We can use the same headings to describe the obturator nerve. In one of the universities, a question was asked, right? If there is a patient who presents to the emergency department with anterior dislocation of the hip. Which nerve is most likely to be injured? Right? Describe the formation, course, relation, branches, and clinical anatomy of this nerve. Remember, anterior to the hip joint, we have the obturator nerve. Posterior to the hip joint, we have the sciatic nerve. So this relation is asked in the form of a case-based question. So this was once asked as a case-based question, the obturator nerve. Okay. Right. Then in the medial side of the thigh, these are the three important three-marker questions we need to be prepared for. Right. Then in the gluteal region, again, this is one more important chapter in the lower limb, right? Here, gluteus maximus, this could be a 10 marker question. This we will discuss at the end of this session, okay? We have two important subtopics which we will discuss once we list all the frequently asked topics. So gluteus maximus, how do we describe for a 10 marker? So gluteus maximus, again, let's say we write a line of introduction. What is gluteus maximus? Gluteus maximus is the largest muscle of the body. Done, one line. Then gluteus maximus, how does it originate? What is the extensive origin of the gluteus maximus? How it gets inserted, insertion, where it is getting inserted. Then what about its nerve supply? What about its action? What about the structures under the cover of gluteus maximus? And then the clinical anatomy, right? So this is how we need to write if gluteus maximus is asked as a 10 marker question. As we will see later in this session, gluteus maximus was once asked as a case-based question. We'll see exactly how it was asked, right? Hi Shwetank, hi. So the next important topic, gluteus medius and minimus. Okay. Now remember, these are the chief abductors of the hip. These are the muscles which will help us in abducting the hip, right? So this is often asked as a 5-marker question or a case-based question on the Trendelenburg, right? The Trendelenburg sign. Okay. They will give a case where they would have described positive Trendelenburg sign, and they will ask what muscles are affected. Describe these muscles in detail. So remember, a positive Trendelenburg sign on one side indicates the paralysis of gluteus medius and minimus on the opposite side. For example, if right-sided on the right hip, we have the Trendelenburg sign positive. The left gluteus medius and minimus are paralyzed, right? So this can be asked as a case-based question or a reasoning type of question, right? Then the Trendelenburg test, this itself can be asked as a 3-marker. What is it? How is it done? And what is its significance? Remember, there is one more Trendelenburg test that we do for varicose veins. So if Trendelenburg test is asked and the examiner has not specified it, it's always better to write both of them. One, to check the abductor mechanism of the hip. One, to check for the varicosity, the saphenofemoral incompetency, right? So Trendelenburg test, remember, this is a tricky question. Unless the examiner specifies the Trendelenburg test of the hip or Trendelenburg test for varicose veins, you will not know what the examiner wants. So it's better to give them the both, right? So in this case, you can write about both the tests. Then one question we can get here as a 3-marker is, what do we mean by greater sciatic foramen and lesser sciatic foramen? What are the structures passing through them, right? This could be an important 3-marker. Piriformis muscle, right? The piriformis muscle is also called as the key muscle of the gluteal region. Why it is called as key muscle of the gluteal region? Because of the important relation it presents, right? So this could be an important 5-marker question for our university exam, right? Then, what is the anatomical basis for intramuscular injections? This is very often asked as an MCQ question, okay? When intramuscular injections are given, to which muscle it is actually given? Most of us would make the mistake of gluteus maximus because this is the largest muscle, right? But intramuscular injections in the gluteal region are actually given to the gluteus medius, part of the gluteus medius which is not covered by gluteus maximus, right? So for this, they usually ask this question to check whether you know where exactly, to which muscle exactly the intramuscular injections are given. Are we clear? So here they might ask you again about the gluteus medius muscle. But again, this could be an important 3-marker reasoning type of question. I've repeated again and again in the exam question papers, which are of CBME type, we get a lot of these reasoning type of questions in 3 markers. Okay, so this could be one important subtopic for this reasoning type of question. So gluteal region, one more important chapter in the lower limb. Then in the back of the thigh and popliteal fossa, these are very favorite topics for the examiners for your gross anatomy practicals. But in theory, what they can ask? They can ask about hamstrings, right? Now, hamstrings could be 5-marker. Very rarely, this could also come as a 10-marker question. What are hamstrings? How do we classify the hamstrings into true hamstrings and false hamstrings or modified hamstrings? What are the characteristic feature of the hamstring muscles? How they originate, where they get inserted, what is their innervation, what is their action, right? So most possibly, right, this could be a 5-marker, but there is a possibility that this could be asked as a 10-marker. Since it is also important for your practical exam, this is one topic in the lower limb that you should never skip. And in this chapter, there is one question which is very frequently asked as a 10-marker, okay? And that is the sciatic nerve. Similar to radial nerve in the upper limb, sciatic nerve is very frequently asked in the lower limb, right? Very easy nerve also, not very complex, related to the nerves of the upper limb, right? We will discuss about sciatic nerve before we close the session today. Then, anastomosis in the back of the thigh could be an important 3-marker. In the gluteal region and in the back of the thigh, there are 2 topics that can be asked, right? One is the cruciate anastomosis, right? Cruciate anastomosis, and the other one is the trochanteric anastomosis, right? These 2 topics are actually described in the gluteal region. So these could be 3-marker questions, right? If the examiner wants to make the paper a little bit on the tougher side. So these 2 could appear in the question paper, right? Cruciate anastomosis and trochanteric anastomosis. Then popliteal fossa boundaries and contents, right? There is nothing much to write here. So this is more or less a 5-marker question. What is popliteal fossa? What are the superolateral and the superomedial boundaries? What are the inferolateral and inferomedial boundaries? What structures form the roof and floor? Then how the structures are arranged in the upper part of the fossa, middle part of the fossa, lower part of the fossa. This could be the question. Popliteal fossa. Remember, any fossa, any triangle that is asked in the body, 2 structures or 2 boundaries that we often miss is the roof and the floor. So when we get questions on the triangles of the neck, femoral triangle, cubital fossa, popliteal fossa, anything, we get excited, we write all boundaries and we happily forget roof and the floor. This is where we will lose the marks, right? Ensure that roof and floor you never miss for any of the fossa, for any of the triangles. Let it be in the neck, let it be in the thigh, let it be in the upper limb. Done. This is regarding back of the thigh and popliteal fossa. Then, when we come to the joints, right? The most frequently asked question in the entire upper limb is the topic of the hip joint. Okay? 10 marker question easily. Right? Apart from this, knee joint could be a 10 marker question. In the topic of the knee joint, the intra-articular ligaments, right? Intra-articular ligaments are an important 5 marker question. Then the menisci of knee joint, where they expect you to compare medial and lateral meniscus, could be an important 5 marker. Then cruciate ligaments, right? The anterior and posterior cruciate ligaments, again, the comparison could be one more important 5 marker question, right? So these are the sub questions which can be asked from the topic of the knee joint. Knee joint itself is an important 10 marker within which we can get these 3 sub questions, right? Then ankle joint can be a potential 10 marker or more frequently a 5 marker question. Subtalar joint is often a 5 marker question. How we would describe any joint? What is that template for describing the answer for a joint? Now, if any joint is asked, we have discussed this already in the upper limb, but we will repeat it again. So again, one line of introduction about the joint. Then we can talk about what type of joint it is. Then we can talk about what are the articular surfaces, right? Then we can list and describe the ligaments. Done. Most of the time, these headings are given. If the headings are not given, this is how we should write. Okay, ligaments. Then we need to talk about the movements and the muscles responsible for these movements. In the entire answer that you write for any joint, this carries the most number of marks. No matter which university, no matter which examiner sets the paper, maximum marks will always be allotted to what are the movements occurring at a joint and what muscles bring about these movements. Done. This is what we need to be prepared for, right? And then if it is a 10 marker and headings are not given, safe to write blood supply, right? Then little bit of nerve supply and end it with clinical anatomy. If the headings are given, these are the headings which will be more often given, right? Blood supply, nerve supply, very rarely asked for any joint. Even if you don't remember what nerves are blood vessels, supply the joint correctly or specifically. Think of the blood vessels which is surrounding the joint and try to write their names. At least do this. Okay. Then knee joint, the same way, right? The same headings. And in knee joint, weightage is often given to these intra-articular ligaments, the menisci and the cruciate ligaments. A detailed description of this is a must, right? Ankle joint and subtalar joint use the same headings. Done? Right. Then in the leg, right? Again, lower limb, very frequently practical examiner's favorite topic for practicals. But if theory questions come from the chapter of leg, a 5 marker question on flexor and extensor retinaculum. Then the nerves, deep peroneal nerve, superficial peroneal nerve. These are often asked as 5 marker question. The deep peroneal nerve is often asked as a case-based question given the example of the foot drop, right? So foot drop case is often given if they want to ask about the deep peroneal nerve. If they want to ask about the common peroneal nerve, this is the case that they will give, right? The foot drop. Then the tibial nerve in the back of the leg, the tendocalcaneus, also referred to as the Achilles tendon, right? How the muscle is formed, how the tendon is formed, how is it or where is it getting inserted, what is the action? So this is a potential 3-marker question. All nerves of the lower limb except for sciatic nerve could be 5-marker question. Soleus, an important 5-marker. Popliteus, an important 5-marker. As we said, flexor and extensor retinaculum. So when we talk about the soleus, right? Why the soleus is called as the peripheral heart, right? What is the anatomical basis? So again, this could be a very important reasoning type of question, 5-marker case-based question. Okay, the soleus muscle. We need to describe in detail the attachments, the action, and then the nerve supply of the soleus. Apart from describing why is it called as the peripheral heart. Done. So in the chapter of the leg, this is one question that we might get. Then the last topic in the lower limb, that is the chapter of foot. Now, if you are preparing for foot, I would invest all my money on the topic of arches of the foot. Okay. Now, this has been asked multiple times as long essay or 10-marker question. Fine. Arches of the foot. So this is one question that we need to be prepared for long essay in the topic of foot. Otherwise, one question which we have often seen from the chapter of foot is what is the cutaneous innervation of the foot, and more so a diagrammatic representation, right? Diagrammatic representation of cutaneous innervation of the foot is a very important 3-marker question. Let it be the dorsum or let it be the sole of the foot. Both are important 3-marker questions. All you need to do is draw a simple diagram, write the cutaneous innervation showing in different shades of color, right? If color is not allowed, use proper labeling to show the representation of different areas of nerve supply, right? But this similar to the cutaneous innervation of the dorsum of the hand and the palmar aspect of the hand will appear as 3-marker questions, right? This is regarding the most important topics, right, that have been asked previously from the section of the lower limb, right? And these are the topics that we need to be prepared thoroughly with, right? Now what we'll do is let's try to see an actual question which was asked in the exam and let's try to solve it. Okay, so we have picked 2 very frequently asked questions in almost all the universities. Okay, now here is the first question. So let's try to read it. Let's focus on, forget about the second question. Let's focus on this. A 40-year-old patient presents with numbness and tingling sensation, right? And radiating pain, where along the back of the thigh, the leg and the foot. So radiating pain, numbness, tingling over the back of the thigh, leg and the foot. On examination, the patient has a compression of nerve in this region. Which region? It is not mentioned, right? So incomplete, and this clue is inconclusive. Physician described this nerve as the thickest nerve in the body. Now this is the giveaway clue, right? Here we had, right, a nerve in mind. Numbness, tingling sensation in the back of the thigh. Possibly this could be sciatic nerve, but compression of a nerve in this region, the sign was inconclusive. Which region we don't know, but the examiner mentioned it as the thickest nerve. Now these are the clues that we need to look into, right? Which is the thickest nerve in the body? The thickest nerve in the body is the sciatic nerve, right? Now name the nerve affected in this condition. For this, possibly only 1 mark will be given for guessing it as or writing it as sciatic nerve. Then rest of it will be for formation, course, relation, branches, and termination. Right? So now we have described the nerve as what? Sciatic nerve. So answer is sciatic nerve. Now we need to describe the sciatic nerve in detail. How to do it? Right? Again, they have given the headings. So we can start with one line of introduction. What is sciatic nerve? It is given in the question itself. Sciatic nerve is the thickest nerve in the body. Done. Then comes the question, how the nerve is formed. Right? Remember, sciatic nerve will be formed by the union of L4, right? L5. Then we have S1, S2, S3 nerve roots. Right? So this is how the sciatic nerve is formed. L4, L5, S1, S2, S3 nerve roots unite to form the sciatic nerve. So this is regarding the formation. Then, how does sciatic nerve will terminate? Sciatic nerve will terminate in the back of the thigh by dividing into the common peroneal nerve and the tibial nerve. Right? We will show it. Okay? Then, what about the course and relations? Right? Remember, the formation of the sciatic nerve. Right? So the sciatic nerve is formed in the pelvis region. Right? So it is formed in the pelvis. It is formed in the ventral part of the pelvis, and then it comes to the gluteal region by passing through the greater sciatic foramen, emerging below the lower border of the piriformis muscle. So we just need to show a diagrammatic representation of the piriformis muscle. So let's imagine this is our piriformis muscle. Okay. So this is the piriformis muscle, and emerging from the lower border, we have the sciatic nerve. Right. So the sciatic nerve further continues downwards, and let's imagine this is the region of the thigh we are talking about. Right? In the back of the thigh, it descends in between the hamstring muscles. Right? Now here, it will divide into two divisions. Okay? Now, what are the two divisions? It will divide into a medial division and a lateral division, which are called as, let's say this is the tibial nerve, right? And this is the common peroneal nerve. This is all we need to describe in termination. Where is it formed? How does it enter gluteal region? How does it enter back of the thigh? Where does it terminate? This is what we need to write in course and relation. The last thing is regarding the branches, right? So we talk about branches and area of distribution. Now, we know that the entire sciatic nerve has a tibial component and a sciatic component. Remember, the tibial component will supply the hamstring muscles. Now, what are the hamstring muscles we have? So we have the semimembranosus. Then we have semitendinosus. Then we have the long head of biceps femoris. Then we have the ischial head of adductor magnus. So all these muscles, hamstring muscles, are supplied by the tibial component of the sciatic nerve. Whereas the common peroneal component supplies only one muscle, and that muscle is the short head of biceps femoris. Right? This is all we need to write about the branches and area of distribution of sciatic nerve. Right? But here we also need to make a conclusion that the tibial nerve is responsible for supplying all the muscles of the leg. Which compartment? Posterior compartment. So all the muscles, let it be superficial muscle, let it be deep muscle, all the muscles of back of the leg, all the muscles of sole of the foot are ultimately innervated by tibial nerve. At least make one line of comment regarding this. And common peroneal nerve. Common peroneal nerve is responsible for supplying the muscles of anterior compartment of the leg, muscles of lateral compartment of the leg, also the skin of these two compartments. This is what we need to write for common peroneal nerve. Are we clear? Right? So main branches, remember, this is a must. Then a line about what is the fate of tibial nerve, what is the fate of common peroneal nerve needs to be written. Right? Are we clear? Then what about branches? I'm sorry, this is regarding the branches and area of distribution. What about the clinical anatomy? The case that is given here as a long essay. This is an interesting case of what? Sciatica. Right? So sciatica could be the first clinical point we will write. What is sciatica? Compression of the sciatic nerve leads to shooting type of pain along the distribution of the sciatic nerve. This is what we refer to as sciatica. Then the second important thing, talk about sleeping foot, right? So compression of sciatic nerve also leads to numbness of the lower limb, as though your lower limb does not exist. If you sit for a long time on the edge of the chair, you get the sleeping foot. So this could be written, right? So this is how we need to describe the sciatic nerve. So it started as a case, then it continued as the anatomical aspect, right? If anatomical aspect needs to be written, this is how it has to be written. Fine. Introduction, formation, termination, course and relation, branches and area of distribution, then clinical anatomy. Hope this is clear now, right? Then let's see one more important question that is again very frequently asked and also as a case-based question, right? Now, let's forget this. This is again from the chapter of abdomen. We will focus on the lower limb question. A 14-year-old boy came with altered gait. Okay. So again, lower limb question. He came with an altered gait few hours after an injection in his buttock. So a possible case of inadvertent intramuscular injection in the gluteal region. On clinical examination, he was having right foot drop. Now, this is interesting, right? So the examiner is directly giving right foot drop. But remember, the injection is given where? The injection is given in the right buttock. When does foot drop happen? Remember, foot drop will happen if there is injury of common peroneal nerve or if there is injury of deep peroneal nerve. Deep peroneal nerve supplies all the extensors of the foot, right? These are also called as dorsiflexors. The muscles of anterior compartment of the leg are called as dorsiflexors of the foot. Paralysis of dorsiflexors results in foot drop. These dorsiflexors are innervated by the deep peroneal nerve, which is a branch of common peroneal nerve. But where is the injection given here? The injection is given here in the right buttock. So is there a chance of injury of common peroneal nerve here higher up? Remember, the nerve that is possibly injured here is the sciatic nerve. Now, since the question is not complete or it is inaccurate as I would describe, what is the answer in this? What is the anatomical basis behind boy's symptoms? Considering that the patient came after intramuscular injection into buttock, we expect the nerve injury of the sciatic nerve. To be on the safer side, how we can describe the answer? So here we can describe as the common peroneal component, right? We can describe it as the common peroneal component of sciatic nerve is possibly injured, right? Is possibly injured. This leads to paralysis of, right? Paralysis of the muscles of anterior compartment of the leg, right? Not just the anterior compartment, this also can lead to the paralysis of lateral compartment of the leg. And this results in paralysis of dorsiflexors of the foot. Paralysis of dorsiflexors of the foot. And this has resulted in foot drop. Now, this is how you can write your answer, mainly because take a look at the marks that is allotted, 2 marks. So simply writing the name of the nerve will not fetch us the marks. We need to describe this flow chart, right? Intramuscular injection into buttock, possible injury of common peroneal component of sciatic nerve, possible paralysis of anterior compartment muscles, which are dorsiflexors of the foot, leading to foot drop, right? So if you can write this as a flow chart, nothing else is required. So this is the first part of the question. Now, we need to carefully read the second part of the question. Most often when we see questions like this, again, we get excited. Okay, fine. The examiner is trying to ask about sciatic nerve. I will write half an hour about sciatic nerve. But then I'll come back and see the second part where the question is, describe the structures under the cover of gluteus maximus. Now, half an hour is gone. I've written about sciatic nerve and the question is not at all about sciatic nerve, right? So here, see, describe the structures under the cover of gluteus maximus. So what the headings are saying, vessels and nerves. Remember again, the question is not about gluteus maximus also. The question is not about all the structures present under the gluteus maximus. The examiner himself is specifying the following structures describe. Describe the following structures under the cover of gluteus maximus, and the vessels and nerves are asked. Now we need to think, right? So let's add a page here. We need to think about what are the nerves, what are the vessels that lie under gluteus maximus, right? First, let's try to list the nerves. So the first nerve is the superior gluteal nerve. Then we have the inferior gluteal nerve. Then, of course, we have the largest nerve, that is the sciatic nerve. Then we have the posterior cutaneous nerve of the thigh, right? Then we also have the pin structures where we have the pudendal nerve, and we also have the nerve to obturator internus. These are the 6 nerves present under the cover of gluteus maximus. What about vessels, right? Let's imagine in vessels we'll focus on arteries. So again, what are the arteries we get? So 2 main arteries, superior gluteal artery, then inferior gluteal artery. Anything else? Here we need to be very careful. Okay. Under the cover of the gluteus maximus, we have what? We have the trochanteric anastomosis. We also have the cruciate anastomosis. List the nerves and the vessels first. Then start describing each briefly. Remember, 4 marks were given to nerves and 4 marks were given to vessels. So what is superior gluteal nerve? What structure does it supply? What is inferior gluteal nerve? What muscle does it supply? What happens if this muscle is paralyzed? What is sciatic nerve? What are the muscles supplied by it? What happens if this is paralyzed? What is posterior cutaneous nerve, the thigh? Which part of the lower limb does it carry sensation from? What is pudendal nerve? What is it a branch of? What are the structures supplied by it? What is nerve to obturator internus? what does it supply? What happens if this is paralyzed? Right? So this is why you need to spend time reading the question. Describe structures under the cover of gluteus maximus, vessels and nerves only. They have not even asked about muscles, joints, bones. They want only the nerves and the vessels. This is the reason why we keep telling, read the complete question. Even before you start attempting the question, please read the question carefully, right? Because after you write everything about sciatic nerve, after you write everything about gluteus maximus, you will realize that the question was not actually on gluteus maximus or sciatic nerve, right? Now this is how your approach should be, right? We know we have not attempted all the questions that are asked in the lower limb, but we have listed all the questions. We have listed, also described and explained how to attempt each question, how to structure the answer for each question. This is what that is required, right? So this is how we should describe the answers for the questions that are asked from the lower limb, right? Please go through the list of topics again and ensure that you are prepared for these topics before you attempt your exam. Done? Before we close, please do let me know if there are any questions related to it. So we'll take it up before we close the session. Any question? We will take it up. Right? So if there are no questions again, uh, I want to highlight again, next week, we will be talking about the abdomen, right? And from the topic of abdomen, we will have at least 28 to 30 marks, right? This is one of the very favorite topic of your paper setters, okay? Apart from the head and neck chapter, head and abdomen is one section where you can get questions up to 28 to 30 marks, right? And pelvis again is again for about like 10 to 15 or 18 marks, right? So lower limb, what we have discussed now is again about 12 to 10 to 15 marks, okay? Now, in that one book where we have the lower limb, abdomen and pelvis, remember this alone will account for about 70 marks, and we have discussed about the lower limb today. Next week, we will talk about the most important questions from abdomen, and coming week, we'll talk about the chapter of the pelvis, right? So do join us for the session on abdomen next week at 6:30 p.m. All the best and prepare well for your internal assessment and the exams. Thank you.